Breezy Blue is an aerosolized hydrogen peroxide fogger designed to integrate seamlessly into environmental services and clinical workflows. Unlike many hydrogen peroxide systems for supplemental disinfection, Breezy Blue requires no extensive room sealing and integrates naturally into existing hospital workflows and room turnovers. Quick Mode supports rapid room-to-room disinfection workflows. Position Breezy Blue in the doorway, start the disinfection cycle, then close the door during the settling period and continue to the next room. Breezy Blue is designed to complement, not replace, routine manual cleaning. Used after established cleaning protocols, it provides supplemental whole room disinfection, including hard-to-reach surfaces and objects that may be missed during manual cleaning. When more thorough supplemental disinfection is required, Full Mode supports improved disinfection distribution. Following terminal cleaning, Breezy Blue provides the final step before the room returns to service. Position the unit, start the cycle, leave the room, and close the door. In approximately 15 to 25 minutes, the room is ready for occupancy. For larger spaces, outpatient clinics, and scheduled disinfection, Schedule Mode provides an automated workflow. Place Breezy Blue in the room, schedule the cycle, and let the system operate automatically during off hours or overnight. This provides a consistent, repeatable process for larger spaces and reoccurring disinfection. To simplify documentation, Breezy Blue can also integrate with Breezy Spot, Breezy Tag, and Breezy Trace. Together, these tools help verify where disinfection occurred, automatically document completed cycles, verify correct disinfection protocols, and reduce the manual effort required for audit reporting and compliance records. Whether supporting routine room turnover, terminal cleaning, or scheduled disinfection, Breezy Blue integrates seamlessly into healthcare workflows while delivering consistent, repeatable supplemental whole room disinfection.